আসসালামু আলাইকুম। আজকে আমরা একটা গুরুত্বপূর্ণ টপিকে আলোচনা করব। উম, সেটা হচ্ছে যে এক্স-রে এক্স-রে অফ দ্য চেস্ট। তো আজকে কয়েকটা বিষয়, সেটা হচ্ছে একটা নর্মাল এক্স-রে কিভাবে দেখা হয়, রিড কিভাবে করতে হয় এবং কমন নিউমোনিয়াতে কিরকম দেখা যায় সেটা একটু আমরা বলবো। তো আমরা একটা এক্স-রে বের করি। যেমন আমি অনেকগুলো, এটা আমাদের বিএসসি অর্থাৎ পিজি হাসপাতালে বর্তমানে আমি যেখানে আছি, পেডিয়াট্রিক হেমাটোলজি অ্যান্ড অনকোলজিতে। তো সেখান থেকে আমার কয়েকটা এখানে তোলা এক্স-রে গুলো আপনাদেরকে দেখাবো। এই যে অনেকগুলো এক্স-রে আমি তুলেছি। হ্যাঁ, এই যে অনেকগুলো এক্স-রে আছে। তো আচ্ছা, আমরা তো সরাসরি তাহলে একটা রিড করি এক্স-রেটা। যখন আমি একটা এক্স-রে হাতে পাবো, তখন সেটা আমরা কয়েকটা বিষয় দেখবো। সেটা হচ্ছে যে এক্স-রেটা আসলে কোন, হোয়াট ইজ দ্য এক্স-রে, ইজ ইট প্লেন এক্স-রে or contrast, right? And which organ or which part of the body? Number two. Number three, characteristics of the patient, as for example age and sex of the patient, and position of the patient, as it is very much important for chest X-ray, as it is posterior anterior or anterior posterior view. So we will look in the X-ray of the chest. How we can read. This is chest X-ray, anterior posterior view of a 2 years old girl, showing first we will consider airway, that is trachea is centrally placed, though the trachea is deviated to the slightly to the right side of the chest, right? Here it is curved to the right side, but right side a slight deviation is normal or physiological, right? So it is normal. Trachea is centrally placed. Airway. B for bone. Bony thorax appears normal, right? We will see the clavicle, we will see the head of the humerus and shaft of the humerus and scapula, both scapula as well as ribs. Okay. And the cardiac silhouette, that is shape and size of the heart, seems to be normal, as it is anterior posterior view. Cardiac shadow or silhouette, we should not comment about this, because in A view it is usually easy to comment. And domes of the diaphragm, both domes of the diaphragm seems in normal position, and cardiophrenic angle and the costophrenic angle appears normal, and the both lungs are homogeneous or normal in size and shape. Both lung fields are homogeneously normal, or we can say if there is patchy opacity, here there are some patchy opacities in the right lung, right? So in the chest X-ray there are multiple opacity present in the right lower, middle and upper part or zone, right, middle and upper zone. And there are also slight opacities on the both parts of the left lung too. So there are multiple patchy opacities present in both lung fields all over all zones, whole lung fields, right? So from these readings, this is maybe bronchiolitis or bronchopneumonia, right? And how we can differentiate upper, middle, and lower zone from we can count ribs. This is first rib, this is second rib, this is third rib, this is fourth rib, this is fifth rib, this is sixth rib. if the lungs are hyperinflation, then the lung crosses anteriorly 6 ribs, then we call it hyperinflation. And up to the lower border of the second rib from anteriorly, it is called upper lobe or upper zone. From the lower border of the second rib to the lower border of the fourth rib, it is called the middle lobe or middle zone, right? In X-ray, we will call it zone, and in clinically, when on auscultate or palpate, we will call it lobe. Anatomically, we call lobe, and radiologically, we will call zone. And below the lower margin or lower border of the fourth rib, below lowards, downwards, this is called the lower zone. Okay. Thus, we can, and when the lung field crosses anteriorly 6 ribs, then it is called hyperinflation of the lungs. It is maybe pneumothorax or maybe bronchiolitis. Okay, we make it. So if we again count the ribs anteriorly, we say first rib, second rib, third rib, fourth rib, fifth rib, sixth rib. Here lungs are not hyperinflation. When we call cardiomegaly, when the transverse diameter of the heart crosses the diameter of the total thorax more than 60%, it is called cardiomegaly in case of children, right? And we should must comment cardiomegaly on posterior anterior view, just say not anterior posterior view. Why it is AP view? Because look at the scapula, the medial margin of the scapula, it is lateral and here lies within the lung field, and the acromioclavicular joint and the claviculo-sternal joint not in the same zone, and acromioclavicular joint lies more higher. Thus, we can, if there is in X-ray anterior posterior is not mentioned, then we will look at the clavicle, position of the acromioclavicular and sternoclavicular joint, and also the scapula. Then we can differentiate from anterior posterior to posterior anterior view, right? And then come to the second X-ray. If we read this X-ray, this is chest X-ray, posterior anterior view, showing trachea is centrally placed, bony thorax appears normal, cardiac silhouette or cardiac size and shape appears to be normal. Both domes of the diaphragm rise in the normal position, and right dome is slightly higher than the left dome, and both cardiophrenic and postophrenic angles are normal, and multiple inhomogeneous opacities present in right lower and left middle zones, and the mediastinum is white. So from X-ray, my diagnosis is this is mediastinal lymph adenopathy with pneumonia or bronchopneumonia or TB or carcinoma lung or lymphoma. We can just radiological diagnosis as hilar lymph adenopathy or mediastinal lymph adenopathy with pneumonia. Or what are the DD? The hilar lymph adenopathy, mediastinal lymph adenopathy includes what will includes lymphoma, tuberculosis, leukemia, sarcoidosis, carcinoma of the lung, those. Actually, this patient is suffering from non-Hodgkin's lymphoma. And here is another X-ray of another patient. This X-ray, just we will see the pathology, is on, this is Yamin, 4 years old, 17 April, and this is 29 April. And there is inhomogeneous opacity present in the left, lower, and middle zone, and most probably the cardiac seal haughty, and also in the right lower zone. And the cardiac seal haughty is obtuse or is unclear, perhaps retrocardiac pneumonia. And here also the pneumonic focus also present, right? So thus we can understand pathology from reading a simple chest X-ray. So thank you all. We will next time discuss inshallah more about chest X-ray, not only chest X-ray, X-ray of the paranasal sinus, adenoid, and others. Thank you. If you have any question, please comment. I will try to answer.